Now, a healthcare story about providing help to those who need it most, even as the debate over replacing the Affordable Care Act continues. One California city has come up with an innovative solution to an intractable problem. Special correspondent Kathleen McCleary reports from Alameda County.
On the south edge of the city of Hayward sits a neighborhood with especially high rates of poverty, unemployment, and violent crime. People are sicker, too. Many suffer from diabetes, obesity, asthma, and other ailments. Options for care here are limited. There's just one hospital, and few doctors welcome Medicaid patients. Some call it a healthcare desert.
South Hayward is a poster child for lack of access to primary care.
When Alex Briscoe was with Alameda County Healthcare Services, he was agency director for 6 years. He hunted for ways to improve access to care. In 2009, as he coped with the swine flu or H1N1 epidemic, Briscoe had a light bulb moment.
Firefighters joined our public health nurses and many other providers, and we very successfully vaccinated and immunized hundreds of thousands of people.
Airway aids, printed tracheal tubes.
Briscoe wondered if firefighters' skills as trained paramedics could help solve another piece of the healthcare puzzle.
This H1N1 experience, combined with our already robust relationship with fire on the EMS system, kind of was like peanut butter and chocolate. Do these two ideas go together, and is there a way for us to use this already existing resource and pre-existing trust as well?
Trust, because approval ratings for firefighters far exceed other public servants. That got officials here thinking about how to leverage manpower and location.
Hey, Hannah.
Hey.
Christelle Acasio runs special projects for the county agency.
Fire stations, firefighters are strategically located in every community. So we saw this as an existing but perhaps untapped resource to serve our patient population. Around the fire station, there is a concentration of low-income residents.
When Acasio examined data about that population, she discovered that the neediest area was just where the county planned to build a new fire station.
And what we can see in this map is that in Hayward, in particular in South Hayward, that the concentration of avoidable emergency department visits is 1.5 times or greater the county rate.
County health officials seized the chance to collaborate with the city, a community health center, and a nonprofit architectural firm to design and build two structures on the same campus. They opened in late 2015.
The clinic's right in front of us and the fire station right here.
Yeah, same style, they look integrated, and basically taking advantage of that sort of known trust and location.
Fire Chief Garrett Contreras was a supporter from the start.
Upwards of 70% of our 911 calls in the Hayward Fire Department are for medical emergencies. Some of these more routine type medical problems can be treated at a much lower cost setting and keep the emergency room beds available for our most critical patients.
Reducing the number of transports to the ER is one way to measure success, says David B. Vliet, CEO of the Tiburcio Vasquez Health Center, which runs 8 community clinics, including this one.
Because we've delivered 6,000 urgent care, convenient care visits here, those are visits that didn't go to the ER. So right away we know we've kept that volume out of the emergency room.
But not everything went according to plan.
Initially, what we wanted the firefighters to do was that we could possibly dedicate a couple paramedics to actually work in the clinic.
That idea was quickly squelched by the California Nurses Association. Karen Rothblatt has been a nurse for 30 years.
You wouldn't want me to come and respond to you in that critical first moment. Not what my training's about. Same, turn that around. I think you could say that a paramedic hasn't been trained to do what a nurse has been trained to do. So why would you have them do that? I think you would be putting people at risk.
My first thought is the Family Feud sound. Look, no nurse would say that while a paramedic is tracheing them or starting an IV line. Paramedics are highly trained and highly skilled, and I think that they can do far more than what they're currently doing. If we remember that the point of our healthcare delivery system is to serve people, not to protect healthcare market share.
Well, I find that insulting, actually. There are jobs out there for nurses. It's not about that. You know, it's really, really about making sure that that clinic really functions in a way that is best for the patients that arrive there.
Can I listen to your heart and lungs and do an examination of your abdomen?
At the clinic, patients are seen by a nurse practitioner or a physician's assistant. No doctor is on staff yet, but they say they're hiring one soon. Firefighters are close by if the clinic needs life-saving care for heart attacks, strokes, or to get patients to a fully staffed emergency room. And proximity promotes communication, too. Those in the field, like Captain LaShawn Ernest, encourage people to use the clinic.
We go on a lot of calls where we can make a determination where someone who doesn't necessarily need to go to the emergency room to tax the system for something, say, for a stub toe. Well, this is someone that could probably use the clinic. Well, did you know the clinic was right next door to the firehouse? Well, no, I didn't know that. Okay, well, you know, maybe I'm fine right now. I don't need to go to the hospital. I have my mother drive me tomorrow to the clinic.
I'll just need to borrow one of your arms, please.
Tina Greaves lost her insurance after an on-the-job injury as a long-distance trucker. For her, the location, next to the fire station, is convenient.
I don't have a vehicle, which is unusual for somebody in California. This one is just seriously within walking distance if I'm doing good, or a 15-minute bus ride. So it's in a perfect location.
Greaves, like most treated in this clinic, qualifies for Medicaid. More than 120,000 people in Alameda County were added to the rolls with the passage of the Affordable Care Act.
The uncertainty over health care in Washington is causing worry here in South Hayward. Cuts to Medicaid could reduce a key funding stream for this clinic, keeping it from being self-sustaining in the coming years. And that's a concern for providers and patients alike.
And I wouldn't be covered by the new bill. That's all there is to it. And it's just like, holy dirty word. So it's an uncertainty, and it's scary.
Ultimately, it means that more folks cannot be seen in a health center like this and would not have a paying source in order to do that.
The partnership of firefighters and healthcare workers is a first for California.
The attempt to bridge the 911 system and the primary care system, I think that's a unique experiment.
I do believe it can be a model. I do believe it will be, can be repeated. It's not easy, not so easy to do, to get multiple governmental agencies to work together, drop the boundaries, drop the egos, drop the who said what, who's doing what, who's getting credit for anything, and just do it because it's the right thing to do and it improves service to the community.
I'm Kathleen McCleary for the PBS NewsHour in Hayward, California.